She has been to my school several times, not to my school, but worked with students from my school several times. She works closely with schools, pediatricians, and other health professionals to provide comprehensive treatment, and is also available to conduct classroom observations and attend school meetings as needed to assist parents in advocating for their children's educational needs. Dr. Bomba's areas of specialty include grief and loss therapy and the cognitive behavioral treatment of anxiety disorders and obsessive compulsive disorder. In 2015, she relocated her private practice from Ellicott City, Maryland to Frederick, Maryland. In addition to providing direct therapeutic services, she is also an author, professional speaker, and consultant. Dr. Bomba is an ambassador for the Mental Health Association of Frederick County, currently serving as immediate past president of the board of directors. She is a member and former board member of the Maryland Psychological Association, a member of the Pro Bono Counseling Project, and a former member of Frederick County's Intra-Agency Early Childhood Committee and ACEs Subcommittee. So with that, we are really thrilled to have Dr. Bomba talk to us tonight about anxiety, particularly in light of the pandemic. We are going to ask, because we are a larger group, that you put your questions into the chat, and Laura and I will help to moderate that. So I'm going to go ahead and share my screen here. And we are also going to pin Dr. Bomba
or spotlight.
Yep. All right. And go ahead, Dr. Bomba.
Thank you so much, Kathleen. It is an absolute pleasure to be with all of you this evening. I'm going to provide an overview of child and adolescent anxiety. I'm going to highlight common triggers, symptoms, and clinical manifestations. And I'll also talk about the role of cognitive behavioral therapy when treating anxiety disorders. Implications of the COVID-19 pandemic and the eventual return to in-person academic instruction will also be discussed. Next slide, please, Kathleen. Thank you. I'd like to start by sharing why I was drawn to specialize in anxiety and grief in the first place. Like many clinicians, when I first began practicing, I accepted new clients seeking treatment for a variety of presenting concerns, basically whatever came my way. I always worked with young children and teenagers, but over the years, I realized that the clients I looked forward to most were the ones struggling with anxiety and the ones who were actively grieving the loss of loved ones. I also realized that this is the work I do best. So quite honestly, I am not as skilled at treating depressive disorders and behavioral disorders, but I'm really good at helping young people learn to effectively manage anxiety and grief. So I fine-tuned my niche areas and now only accept new patients for my areas of specialty. I think I was drawn to both anxiety and grief because they are, simply put, human conditions. We all experience them. They are normal, not always necessarily psychiatric. They are inevitable. And I absolutely love being able to empower young people to tolerate the discomfort of these difficult emotions, to help them be brave, to help them do hard things. Many parents bring their children to me in hopes that I will assist them in reducing their anxiety. And I always tell them that that is actually not the goal. The goal is to learn to better tolerate the discomfort of anxiety rather than avoid or escape it. Anxiety is a natural human reaction that occurs whenever we perceive danger or threat. And it's important to teach children how to tolerate stress in order to develop resilience. Children need to learn how to recover from failures and disappointments. The COVID-19 pandemic has changed all of our lives in so many ways. We've experienced changes and losses in the way we work, in the way we stay connected to friends and family, and for children in the way they attend school. Most of us have been grieving pretty hard these last 10 months, and children are not exempt from that. And the uncertainty regarding the course of the pandemic moving forward results in the loss of the way we once thought about our futures, a loss of a sense of safety and security. Children and teenagers are feeling this too. Obviously, in my world, anxiety and grief go hand in hand, but today I'm going to focus primarily on anxiety. And I understand that some of you work with elementary age children, some of you work with middle and high school students, and I believe a few of you even work in college settings. So I will do my best to develop or to discuss differences that exist across development. A lot of the symptoms and manifestations are the same, really, and the basic treatment recommendations are the same. Next slide, please. So what does anxiety look like in children and teens? Anxiety can present in a number of different ways, but common manifestations include somatic or physical symptoms. So we're talking about stomach aches, headaches, increased heart rate, muscle tension, fatigue. And these symptoms are common in children and adults of all ages. In school-age children, anxiety often leads to frequent visits to the school nurse. Anxiety can cause difficulty falling asleep or staying asleep. It's a common complaint. Actually, bedtime is one of the most common times for anxiety to manifest. And this makes sense, right? Because throughout the day, we're focused on our work or school or other things, but when our heads hit the pillow, we're alone with our thoughts. And if an anxious pattern of thought has formed, it's easy to experience an anxiety loop. Anxiety can also present as irritability. Excessive worry is probably the most recognizable symptoms. Worry is often expressed in question form and usually begins with, what if? What if thoughts can lead to difficulty concentrating, difficulty sustaining attention. Rigid thinking and a rigid mindset often leads to anxiety. So words like always and never, absolute or all or nothing thinking can cause anxiety and frustration. In my practice, I often see anxiety manifest in the form of perfectionism and compulsive behaviors as well. And of course, avoidance of anxiety-provoking situations, whether that be birthday parties, social gatherings, music class, or school altogether, we tend to want to avoid things that make us uncomfortable. Next slide, please. So here I've listed some common anxiety triggers for children and teens. Of course, anything can serve as a trigger for anxiety. There are rational triggers, there are irrational triggers. Very young children often express irrational fears related to wolves living in their homes. I hear this all the time. That seems to be a rather common one, and I think we have Disney movies to thank for that one. Other common child anxiety triggers include separation from a caregiver. And it's important to note that separation anxiety is common and age typical in young children under the age of 6. It's not considered to be out of the realm of possibility or abnormal if it's occurring under the age of 6. Social interactions, social drama can cause a considerable amount of anxiety, especially at the middle school level, especially in girls. Family dynamics can obviously create anxiety. If there's conflict in the home, whether the child's involved in family conflict or simply a witness to heated arguments or aggression. Children also absorb adult worries expressed in the home, like their parent stress, financial stress, COVID stress. School and academic related stress can cause a lot of anxiety for many students. Public speaking makes most of us anxious. Test taking creates anxiety. And the P word, the dreaded P word, perfect. Today's children often feel pressure to perform at an extremely high level and often unreasonable level. And some children never feel good enough. And if you think about it, this makes sense. If your standard is perfection, then you're likely feeling like a failure most of the time, since perfection is an unreasonable, unrealistic standard. Athletic performance is another common anxiety trigger, especially sports like baseball and softball. At least that's true in the athletes with which I work anyway. There's a lot of pressure placed on athletes in the slower moving sports where all eyes are on one person at a time. The pitcher, the kid up at bat. If a mistake is made, everyone in the stands notices. It's different, it seems, in sports like football, where people watching the game notice the mistakes, but quickly shift their attention to the next play. So I end up seeing a lot of athletes, softball players and baseball players who were struggling to manage their anxiety. Many children today feel quite overwhelmed. Many are overscheduled and have too much to do. So managing hectic schedules can cause anxiety. Crowds can cause anxiety, and being alone can cause anxiety. Loss also creates anxiety. And when I'm talking about loss, I'm not just talking about death. Really, change equals loss equals grief. Separation and divorce often leads children to experience what-if thoughts related to the changes in family dynamics, uncertainty. And death, of course, can also lead to anxiety. Death of a parent might lead to anxiety thoughts like, what if my other parent dies? Who will take care of me? What if I die? Specific phobias also cause anxiety. They might be less common, but the one I see most often in my practice is emetophobia, the fear of throwing up. I typically get an influx of new patients in the fall and winter during cold and flu season related to this fear. I have not gotten any new patients for that this year. I think because people are staying healthy for the most part, as long as they're following guidelines, aren't getting colds and flus as often, which is good. In the spring and summer, I see a lot of phobias related to bees, and I also see quite a bit of needle phobias when kids require vaccinations, blood draws, and other medical procedures. Next slide, please.
Dr. Bauman, there's a question in the chat. Working with elementary age students, is there a general time span between the trigger and manifestation of anxiety?
I guess I would need more information about the type of trigger we're talking about. Can the person who asked the question give me a little more information?
Naika Riley.
Hi, I was wondering, so let's say a student has a test to take on Tuesday, and Monday evening they start to show symptoms of anxiety. Is there like a time span between, let's say they were told Monday they have the test, and then Monday night they go home? Is there like a time span there?
I think I understand what you're asking. Thank you.
Okay.
I think it's really individual. For each kid, it's different. Some kids will start really stressing about it, as soon as they find out about the test or the night before. But with test taking anxiety, at least when I'm talking about it, I'm typically referring to like while you're taking the test, experiencing the anxiety during the test. So much anxiety where it's maybe producing panic symptoms and your heart rate's increased, you're distracted, you can't concentrate, sometimes your vision is blurred. So it's interfering with the actual taking of the test, not the preparation part. Does that clarify?
Yes. Thank you.
Yeah, but again, it can manifest in any form. So yeah, you can certainly have anxiety leading up to it. But usually when I'm talking about test taking anxiety, I'm talking about during the test.
Okay, thank you for that.
Yeah, you're welcome. Other questions right now or?
Nope, go on, thank you.
Okay. So here I've, on this slide, outlined some basic suggestions for helping students manage anxiety. These are strategies for counselors, teachers, coaches, parents, really any adult who's helping a child manage anxiety. These suggestions may sound obvious. However, it's important to remember that adults tend to want to help children feel better when they're uncomfortable or hurting. Parents and even teachers want to fix it, right? They want to help the child's anxiety go away. But rather than focusing on decreasing the anxious feelings, adults should support children in managing anxiety thoughts and physical symptoms, problem solving, and tolerating the discomfort of the uncertainty that remains. So using a supportive and non-judgmental tone, Normalizing and validating are likely the most supportive things one can do. It's important to refrain from dismissing or minimizing worries by saying things like, "Don't worry about that," or "You don't have to worry about that." Telling someone not to worry about something does not help. Telling a child that their biggest fear is not going to happen does not help, because when anxiety is activated and overriding logic, anxiety responds by suggesting, "But it might happen though." So it's important that we validate. It's also important that adults teach children calming strategies to ease the physical symptoms of anxiety. Diaphragmatic breathing, journaling, drawing, and physical exercise help to externalize emotion and reduce physical symptoms of anxiety. I encourage children of all ages to practice relaxation strategies throughout the day when they're calm, so that they're easier to implement when they're feeling anxious. We really have to master, especially diaphragmatic breathing. We have to master that when we're in a calm state. Once physical symptoms are decreased and more tolerable, then it's helpful to engage children in collaborative problem solving to manage anxiety-provoking situations. Adults can provide assistance by using logic to counter and shrink anxiety thoughts. They can structure problem solving by assisting children in identifying the problem, collaboratively identifying possible solutions, considering the pros and cons and potential consequences of each solution identified, and then finally choosing the best option or options. I think it's really important to teach children that no matter how big the problem, they always have options. It's an important message. So a plan can be created. What do you need in order to fill in the blank? Set and clarify realistic expectations, assist with prioritizing and time management, juggling school, homework, and long-term projects, sports, hobbies, socialization, family time. Children need help setting healthy limits, like a cutoff time for homework completion, a limit for daily screen time. That's laughable right now, but we did used to set limits for daily screen time. And of course, they need reasonable bedtime. Adults should also model cognitive flexibility and use of healthy coping skills. Children learn by observing the adults around them. So when they see us taking calm breaths and verbalizing our thought process to demonstrate use of logical self-talk, when they observe us taking timeouts when we need them and sharing the problem-solving methods we use to face our fears, they're learning how to cope with their own stressors and solve problems of their own. Finally, I think it's most effective to create a team when supporting a child. So I always encourage parents to communicate closely with the other adults in the child's life, teachers, coaches, religious leaders, whoever they can rein in. This way, adults can more easily assess the level of impact anxiety may be having on school, sports, or social functioning. And it's also easier to measure progress and identify any new areas of need. Next slide, please. So why is all of this so important? Why not simply wait and see if children struggling to manage anxiety grow out of it as they get older? In my opinion, children don't grow out of anxiety. These are skills that need to be learned. And it's easier to create adaptive thought patterns and to form healthy coping habits at a young age. At least I think so. This is why I choose to work with children. I assume, and maybe I'm wrong, that it would be much more difficult for an adult to rework maladaptive thought patterns and replace unhealthy methods of coping that have been around for 30 or 40 years. So the benefits, some of the benefits of well-managed anxiety include a positive sense of self, increased confidence, improved peer relationships, increased academic performance, and maybe the most important, improved resilience. We all must learn to manage anxiety. And I don't know about you, but I was never taught how to do it. I had to figure it out on my own when I was in my 30s. And I believe that life could have been less difficult to navigate at times if I would have learned adequate anxiety management skills when I was a young child. And every one of us on this Zoom call today can have a role in helping young people learn these skills that they can use for the rest of their lives. Next slide, please. So not everyone needs therapeutic intervention. I generally suggest that a referral for anxiety treatment be provided when symptoms increase in frequency, duration, or intensity, or if anxiety persistently interferes with sleep, happiness, social or family relationships, or academic functioning. That being said, it's always easier to get ahead of it. So to arm children with the ability to manage stress and anxiety-provoking situations before it becomes a problem. So many families initiate professional therapeutic services preventatively. In fact, in the last few years, I've had a number of families initiate therapy for their very young children without any presenting problems, simply because they want their kids to grow up with a feelings doctor. They want their children to learn healthy coping skills and effective problem-solving skills. They want to work to prevent psychiatric disorders from forming, and they want to decrease stigma associated with seeking mental health care. I am convinced that these are the children who will rule the world one day. They will be so well adjusted. That being said, if symptoms of high anxiety or poorly managed anxiety are already present, a referral should be provided for a qualified mental health provider. And as you know, anxiety is a common presenting problem. Most mental health providers indicate that they treat anxiety. However, there's a big difference between supportive therapy with a generalist and specialized anxiety treatment. Next slide, please. Cognitive behavioral therapy is the evidence-based recommended treatment for anxiety disorders. CBT involves active skills-based learning and requires an active participant. It's not what I tend to call endless talk about your feelings therapy. There are identified measurable treatment goals, and homework is often involved in between many of the sessions. CBT focuses on the relationship between thoughts, feelings, and behaviors. And treatment specifically focuses on helping children learn how to first discern between anxiety thoughts and logical thoughts, how to ease physical symptoms of anxiety, shrink the level of anxiety, and then tolerate what remains. So the goal is not to get rid of the anxiety, but to shrink it to a more manageable level. CBT essentially teaches people how to be brave, how to be afraid, but do things anyway. It empowers kids to learn how to do difficult things, and CBT builds resilience. So there's a couple main elements of CBT. The first, in my mind, being psychoeducation. It's important at the beginning of treatment so children understand how anxiety works in the brain. Relaxation training, of course, helps children understand that our bodies send us cues and that we can learn how to regulate our physical responses to stress. And cognitive restructuring helps to identify the maladaptive thoughts that are causing the anxiety in the first place, the what if thoughts that aren't serving us well. This process essentially retrains the brain to think more adaptively. Exposure therapies like gradual exposure therapy and systematic desensitization are incredibly helpful. Exposure therapies help children practice tolerating the discomfort of anxiety-provoking situations, usually in successive approximations, and oftentimes in extreme manners. Because if you come in and have a fear of elevators, an intolerable fear of elevators, and if you can eventually tolerate the discomfort of riding the elevator to the top of the Washington Monument, you can later tolerate everyday elevator needs. Active parent participation in a child's cognitive behavioral therapy experience is needed. Parent support and training sessions teach parents how to respond consistently to various anxiety behaviors. Oftentimes, because parents want their children to feel better, they inadvertently accommodate the anxiety by helping children avoid or escape anxiety-provoking situations. So that's working against the goal of CBT. CBT parent work helps parents learn to support their child and their child's therapeutic process. But not every child is a good candidate for this type of work. In my experience, good candidates for CBT, and actually good candidates for CBT by way of telehealth, tend to be 4 years of age or older. Abbreviated video sessions with parents present are available for toddlers. They tend to be verbal, good candidates would be verbal, and they would desire relief and are motivated to engage in treatment. Good candidates are children whose parents are active members of the treatment team. CBT, and especially delivered by telehealth, may not be appropriate for children under 3 years of age, children who are not yet verbal, children or teens who are forced to engage in treatment and therefore not invested or active participants, children who are oppositional or defiant, or who have untreated or poorly managed attention disorders, and children whose parents do not participate in the parent or family sessions. Next slide, please. So let's talk about the ways in which the COVID-19 pandemic has impacted anxiety in children and teens. This picture, I just love this image. I mean, I feel like it just, I feel like you could just feel the anxiety and the sadness, the grief. I guess I'll start by saying that mental health needs to be on everyone's radar right now. Both the mental health of students and the mental health of the adults who care for and provide services for children. I'm not sure if any of you have transitioned yet to in-person instruction or a hybrid learning model, but no matter when this becomes your reality, I think it's important to note that every student will be returning to school having had different experiences for the last 10 months. Many have experienced increased anxiety. About what? You name it. Germs and contamination fears through the roof. Getting sick, family members falling ill or dying. Anxiety about things that have nothing to do with the virus at all, about making mistakes, natural disasters, about wolves living in their bedrooms. Many children have experienced confusion and worry related to their extended family members and friends who've not been following CDC guidelines. I hear that a lot. Those children whose families have been following CDC guidelines have experienced a decrease in social connectedness and have felt isolated. For many children, social skills development has been halted, as the majority of socialization they've received in the past years has been with household family members. Some family members or some families have maintained a routine at home, but few can mimic the structure of the traditional school day. And as many of you know all too well, many parents have been working at home while doing their best to help children navigate virtual learning. Some families seem to be doing this rather well, but many are struggling significantly. And some families lack structure and routine altogether. Everyone's screen time has increased dramatically because it had to be increased dramatically. Many students changed the way they approached school. There's been changes in the way that they participate. Their participation levels are different, and even their levels of engagement. Motivation has decreased for many, and some have stopped completing academic work altogether. Many children have not engaged in much physical activity, whether it be from not playing organized sports or from living a more sedentary lifestyle. High school athletes have been concerned about eligibility for college scholarships. Many children of all ages have experienced decreased mood, increased depression, and suicidality. Some families have experienced increased family conflict, domestic conflict, and abuse. And then there's loss again. The loss of normalcy, routine, friendships, socialization, special events like prom and graduation. Some children have experienced the death of a loved one during the course of the pandemic, either as a result of COVID-19 or some other cause, and they were unable to visit their loved ones during their final days or unable to attend funeral services because of the pandemic. And on top of all of this, throughout the last year, the social injustice, civil unrest, political divisiveness, contentious presidential election, This is all added to the stress children have experienced, especially teenagers who've been keenly aware of what's going on in our world. I can tell you that in my private practice, I have seen a significant increase in anxiety and depression in my existing patients of all ages. Maybe most notable is that during the first 6 months of the pandemic, I hospitalized more children and teens than I have in the last several years combined for suicidal thoughts and attempts. I've also had to file more suspected child abuse reports than I have in previous years. And this was my experience. I can't say for sure whether it's representative of what other clinicians have experienced, but regardless, it's pretty alarming. We are truly in the midst of a mental health crisis. Children are struggling, their parents are struggling, educators are struggling. I think it's safe to say that throughout this pandemic, we have all experienced an increase in both anxiety and grief. And thank goodness for telehealth. It has allowed continuity of care when many children needed it most. This was never something I ever considered doing before the pandemic, but it will absolutely continue to be something I keep as an option when the pandemic is over. Next slide, please. Okay, 10 plus months of virtual learning. 10 plus months. Some students are doing very well with this format. These are the students who work well independently. They manage their time effectively and have supportive and available parents or caregivers. Many of these students are self-identified introverts and enjoyed the lack of social pressures and distraction. Many of these students also typically struggle with anxiety related to school and social interaction, and the virtual learning environment allowed them to avoid. So while this worked well for them with regard to virtual learning, this does not likely bode well for their anxiety management. Remember that the goal of anxiety treatment is to learn to face one's fears and tolerate the discomfort, rather than avoid or escape the thing that causes anxiety. I worry about these students as they transition to in-person learning. Most of them will choose not to if given the option of a hybrid model, but they will have to return to in-person instruction eventually. And it's kind of like the longer you're gone, the harder it is to go back. I'm concerned about these kids. Now, while some students have done really well in the virtual learning environment, others, dare I say many, are struggling. Many experience attentional difficulties. Many have struggled to create and maintain routines. And many have not had adequate separation of home and school. For example, many students I know complete virtual learning at a desk in their bedroom, which is of course not optimal as there are many distractions, including their bed to lay down on. Some students have lacked needed learning supports. Many have suffered from anxiety, depression, and low motivation. There's a reason why children attend school in person under normal circumstances. I think the students that I'm talking about now will probably do really well when they transition back to in-person learning. Next slide, please. So I've identified a few suggestions to ease the transition to the eventual return to a hybrid model in-person academic instruction. So I know in the past, some elementary school classrooms have used calm down corners as safe spaces for elementary age children to visit if they need a quiet minute to work through their feelings. Because you'll now be separating the students and materials as much as possible, I'm assuming that you can no longer have areas in the classrooms like that. I think it'll be really important to identify ways that young students can manage and process their emotions while remaining at their desks. And what are the other safe options? Is it possible to grant them permission to take a breath of fresh air near an open window or outside, have a sip of cold water, wash their hands, have essential oils available to smell, a mint to eat? Trying to think outside the box here, changing the sensory experience can help. Again, with younger children, maybe first through third grade, they hug each other, right? This is how they show affection. A lot of times they touch each other. So it'll be important to teach and encourage, the reading and communicating using nonverbal communication and keeping distance. encouraging waving and verbal greetings. And this is a great opportunity to improve children's ability to express themselves verbally and to improve their expression of feeling. Even if it's just talking about like how to read somebody's facial expression from here up, like what about the wrinkles in their forehead and their eyebrows being raised? So there are opportunities here. Everybody's going to be coming in from different situations. Some kids have had socialization. They've been going to the Y or other daycare type centers, things like that, while others, have been at home with mom and dad for all this time. I think it'll be really important to get kids talking about their feelings and their experiences surrounding the pandemic, surrounding the return to school. I would acknowledge the weirdness of all of it. How weird is it to be back and we're all wearing masks? Have them identify the best and worst parts of the pandemic and how they feel about returning to school. Encourage expression of feelings, worries, whether privately or in group discussion, and engage them in collaborative problem solving. I almost wonder for younger kids, could you set up a system where students could send each other encouraging messages to validate and show support, and again, acknowledge the strangeness and the difficulties? I think, Mondays are difficult, right? Transitioning back to school after winter break is difficulty. Returning to school after summer break is really tough. It has been 10 months. Kids change so much in that amount of time. The peer dynamics might be quite different than they were when they were last in school almost a year ago. You can assist students in identifying and shrinking their worry thoughts. So I would ask questions like, what is the worst case scenario? Or what's the worst thing that could happen? How likely is that to happen? What's in your control? What could you do if that happens? And then you can engage them in collaborative problem solving. I think you might see increases in separation anxiety in younger students who've been home with their parents for over 10 months. You'll see an increase in somatic symptoms and trips to the school nurse, attempts to avoid or escape certain situations. And you might see hesitance from some students to remove their masks to eat or to be too close to other people, which could cause some difficulty navigating social relationships. Basically, social skills may need to be refined. I think there might also be, a conversation between kids about the pandemic and guidelines, and there might be misinformation that needs to be corrected. So those will be some things to look out for. Let's see. I think that was all I had to say about that. Next slide, please. So navigating this temporary, I'm calling it temporary, new normal as a helping professional. My 3 biggest pieces of advice for you will be to expect the unexpected, to lean into the uncertainty, and to help students do the same, and to practice what you preach. So I'm talking self-care. It sounds like this group, you have a lot of self-care activities coming up. This is great. So paint night and all these things are wonderful. Journaling, breathing. I don't necessarily mean get a massage or get your nails done for self-care. I mean really take care of you. Pause and take a cleansing breath once in a while. Begin and end each day with a few minutes of mindfulness. Be mindful of your self-talk and take walks. Slow down. Allow yourself to truly taste your coffee in the morning. Take care of your mental health. For me, I found that pausing for just a few seconds to take just one slow diaphragmatic breath in between my telehealth appointments helps tremendously. And if I don't have a glass of water right next to my computer screen, right here, I will literally forget to drink water all day. So I make a point to refill my water glass in between each session, which also gets a couple of steps in. They're small but important things I've learned I need to do to keep myself well. Most of us are running on fumes these days, and we must pause to refuel. Next slide, please. I've included a few of my favorite anxiety resources. You can take a picture, screenshot, or this is being recorded, right? I always recommend reputable websites when you're doing research about anxiety. Next slide. I've included a few of my favorite COVID resources for children. And there's one towards the bottom there for teens and adults. The first one is for very young children. It's a little workbook. The second one, My Epidemic Story, there's no link. I realize that it was really long whenever I tried to include it, but if you Google this, you'll be able to find it. It's kind of a nice guide for older children, parents, and teachers. Care for Your Coronavirus Anxiety is really great. It's for teens and adults and addresses all things COVID related. And then my most favorite website ever is kidshealth.org. You can truly put anything in the search, whether it be heart disease or anxiety or OCD or anything. And there are buttons to click at the top. Click here if you're a kid, click here if you're a parent, click here if you're a teen. And it provides really understandable language about various health concerns. Next slide, please. Finally, I'm going to list my favorite crisis resources. The top ones are for resources throughout the state. The bottom ones are crisis resources here in Frederick. I know that many of you on the call today are from Frederick. If you're not familiar with what your local crisis resources are in your area, I would strongly encourage you to become familiar. One of our best resources here in Frederick is the Mental Health Association, their walk-in behavioral health clinic. They're open every single day at no cost. You don't need an appointment, and they have both virtual and in-person crisis services available. So it's really a nice alternative to the emergency room. And I think most counties have something like that. Last slide, please. I want to thank all of you for listening. I know that we'll have some questions, so we're not over yet, but thank you for all you do to support the children in our communities. I will be sending each of you tons of positive energy as you continue to navigate this unique and challenging school year. And I'm happy to chat, you know, if any of you want to reach out to me personally, I'm happy to be available as needed. So thank you.
Thank you, Dr. Dwamba. If we want to circle back, there was a couple questions in the chat. Some were asking for some tips for using CBT strategies for young children and middle schoolers dealing with anxiety.
So specific strategies?
Yeah, some strategies. Mm-hmm.
So hopefully this will answer the question. If we're talking about starting with psychoeducation, because I think that's the first step, I would, I will often draw out a picture of the child that I'm working with, and I'll draw a picture of their brain, and I talk about how we're all born with logical, intelligent brains that know right from wrong, safe from danger. But we have these invisible worry bullies that kind of float around, and I draw that outside of the head, right? I don't want kids to over-identify with like having an anxious brain or being an anxious kid. So then the worry bullies floating around out here, whispering in these what if thoughts, right? What if you get sick? What if I get sick? What if I die in my sleep? Now your logical brain knows that's really unlikely, and I'm a healthy kid and I'm young, but the anxiety overrides logic sometimes. So once they kind of have a clearer understanding of how anxiety works in the brain, then we start to question. When you have these what if thoughts, that's a clue that it's probably an anxiety thought and not a logical thought. So then what do we do with it? You shrink the somatic symptoms first, right? So you can teach them relaxation skills to ease the physical symptoms. And then once you do that, then they're available for logical problem solving. So you might come up with a list collaboratively, a logic list. Let's make a logic list to shrink that anxiety thought. I always like to say, you know, while your survival rate is 100% so far, right? How many times have you died in your sleep? None, right? So that's a piece of logic. Again, you're young, you're healthy. So you create pieces of logic that will counter that anxiety to shrink it. You might even say like, well, how big is your anxiety on a scale of 1 to 10? If this worry is an 8 out of 10, let's use some logic to shrink it. And if we can get it down to a 4 or even a 5, that's much more tolerable. So we're not trying to get rid of it. That's pretty impossible with most anxiety thoughts, but I consider it a win if we can lower it by a few points. So really empowering kids that way. I hope that answers the question.
Yes, that was great. Thank you. Another one that shared, please share what worked with children feeling like they would throw up.
Yeah, so it's really about exposure therapy there. I don't make kids throw up. Let me back up. Imaginal exposure therapy is what's helpful there. We do a little bit of the, we do the relaxation training, of course, the psychoeducation piece and the cognitive restructuring and, you know, the logic lists, right? First of all, how often do you throw up? Hardly ever, most of us, right? Usually you feel better once you do throw up. It's not enjoyable, but you can handle it. I'm always really just empowering, right? Like, you can handle this. It's going to be awful. It's going to feel terrible, but you'll get through it. Again, your survival rate is 100%. But with exposure therapies, and this has to be done in a pretty systematic, careful way, we'll create a hierarchy. So the child will put in order, like, how difficult would it be to look at images of somebody throwing up? How difficult would it be to tolerate the discomfort of watching a video of someone throwing up? And then we'll go through and, you know, I'll expose the child to these situations, but we'll stay on the one level for as long as it takes. If the first thing on the child's hierarchy is looking at an image of somebody throwing up, then we'll do that in office, or I'll share my screen and we'll do it over and over. And we're doing it together, tolerating the discomfort, letting the anxiety rise and tolerating it. And then for homework, I might have the child continue to look at these images with a parent over and over and over until it's really not that hard to do anymore. Then we consider that item mastered and we go into the next one and we do that one for as long as it takes. When kids are brave enough, I have them get those awful jelly beans that taste bad. I can't remember what it's called. It's that game where some of the jelly beans taste good and some of them taste bad. Well, there's a vomit one. I think it's either peach or vomit, right? The orange ones. And so you take your chance. I'll have them break it open and we'll smell it while we're looking at videos of people throwing up. If they're brave enough, they'll eat one. That's great. I mean, if they can tolerate the taste of vomit in their mouths, watching people throw up on, you know, on videos, usually that's enough. You know, that whole process will shrink the fear. And honestly, the best thing that can happen is for the child to actually get sick and vomit after we've done this process, because then it's like, oh yeah, it wasn't that awful. It wasn't enjoyable, but I can tolerate it.
Yeah, that's great. And here's another one, a good one I can relate to. How do you handle a child who is scared of being called on during virtual learning? And it's also will not go into the breakout rooms because their fear of being, you know, on the screen or in person.
This is so difficult because, again, children have been able to avoid this for 10 months now. They've turned their cameras off. They just, if it gets really anxiety provoking, they just close the laptop. I mean, it's terrible. So this is tricky. I encourage them to do that. You know, we might even set goals. It'd be great if you know, I guess if you're able to communicate one-on-one with a child about this, you might have the child set the goal. Like, I'd like you to participate in class this week. How many times do you think you could raise your hand or put something in the chat box? If you can put it in there, if you can put the ball in their court, that might be easier than calling on someone when they don't have their hand raised. That seems a lot scarier, right? So if you're comfortable starting that way, or you might even say, I'm going to call on you twice. When would you like me to? Do you want me to ask you a question about this or about that? So by providing them some control, that might help. About a breakout room, I'm not sure. So if they're refusing to go, I guess I'm not sure what happens, what that looks like. If they don't participate or if they just like.
They just leave.
They just leave. So again, I would maybe try to set a parameter like, okay, if you can have a one-on-one conversation with the child, I'm going to need you to participate in a breakout room. Let's make a plan for how you can handle that, how you can tolerate the discomfort of that. If you can get to the root of what the worry is, that might be helpful. What are you worried might happen if I put you in a breakout room? You know, is it about, would you say something and the other kids would laugh? Would you not know the answers? You know, whatever. if you know what the problem is, then you can help brainstorm solutions. Or maybe you say, I know this is really hard for you. How long do you think you could stay in the breakout room? You know, if you want them in the breakout room for 20 minutes, do you think you could do 10? Maybe by providing some options that might help. Is there an option to have the camera on or off? Because they're used to having the camera off. But if you can, I guess, tighten it up with some specific goals and use collaborative problem solving, that might be helpful.
One more, I think we have time for one more. Back to the calming corners, you know, since that's not going to be there, maybe some strategies to replace them, or some ideas of some new ideas of what we can do for our kiddos that need that.
Yeah, well, like I said earlier, I think we're just going to have to get creative and think outside the box for this one. So it'd be great if you could teach children how to calm themselves at their desk. They're already going to be spread out a little bit more, I assume, right? So they're not going to be right up on other people. Maybe putting their heads down at their desk for a few minutes, encouraging them to put their heads down and use some visualization. Again, I provided some examples of some sensory things because sometimes that just kind of throws us off a little bit. It kind of helps us reset. So washing your hands in cold water, or, you know, if you're able to, breathe in cold air, or smelling a scent, something like that might be helpful. But I think providing kids with concrete options is going to be important. Maybe you could even have a discussion with the kids. You know, here are some ideas I have. What else could you do at your desk if you need a break? And how could you alert the teacher that that's what you're doing? I just need a couple minutes. I'm putting my head down.
One more. Can you share, can you speak to anxious behavior, specifically young children? I don't know. What can do best for students having a panic attack?
So panic attacks are a bit different because not always, but oftentimes panic attacks come on without triggers, without warning. In fact, the most common trigger for a panic attack is worrying that you're going to have a panic attack. Panic disorder needs specialized anxiety treatment. And again, if there is a trigger, let's say being in school is a trigger, right? Again, we don't want to allow the child to avoid the discomfort. So it's always terrible when parents allow children to stay home because of anxiety. It's the worst thing they can do. It's better to create a plan with the school counselor and the nurse and everybody else. And okay, this person's really anxious about being here. What can we do, right? Provide supportive accommodations. Let's not support the anxiety by avoiding it or escaping it, the school environment, but instead, you know, is there a private space where the student could sit and do independent work for a while? Could the student tolerate going to some classes? Things like that. If there's a panic attack, I would try to do your best to move the child to more of a private space to limit the amount of embarrassment, and to engage in diaphragmatic breathing and maybe some logical statements, right? Panic attacks don't last long, right? It's usually over in less than 20 minutes. Again, your survival rate's 100%. You can handle this. I would provide distraction, and then I would return to class.
Well, thank you so much. This is very helpful, especially as we are transitioning back into the in-person, at least in a hybrid situation for us. So that was very, very helpful. Kathleen, do you have anything for Dr. Bomba before we close out?
I would just say thank you. I really appreciated just listening to you and your calm demeanor, and thank you for all the helpful tips.
Well, thank you. It's been a pleasure. I wish you all the very best.
And that statement that said, you know, it's 100%. What did you say? 100%?
100% survival rate.
Survival rate. Yes, 100% survival rate. I love that, because that gives them that hope that, you know, it's a struggle. It's not comfortable, but you'll survive it. It's 100% survival rate. I love that.
Mm-hmm. So far. Yep.
Yeah, exactly. There's a lot of thank yous in the chat. I'm going to stop the recording now. Let's try